A 10 years old child reports with the history of the pharyngitis. Since last 5 days, he is diagnosed with the Streptococcus pyogenes infection. Further sub-serotyping of Streptococcus pyogenes is done on basis of option A M protein, option B T protein, option C R protein, option D carbohydrate, C antigen. Answer is A, that is M protein. Let's start explanation for this is Streptococci. Streptococci is gram-positive cocci arranged in the chains or the pairs. It is a part of the normal flora of the human and the animals. The some of stems of streptococci are human pathogens. For example, the Streptococcus pyogenes, which cause the pyogenic infections. Streptococcus infections have tendency Streptococcus pyogenes infections have tendency to spread. Streptococci also cause non-suppurative lesions, acute rheumatic fever, glomerulonephritis. That is Streptococci first seen in the erysipelas and wound infection in 1874, and it is isolated from the acute abscess in 1881 and distinguished from the staphylococci and established their pathogenicity and by the animal inoculation. It is isolated from the human suppurative lesions in 1884. Now classification of the streptococci based on the hemolysis on blood agar as the alpha hemolytic, beta hemolytic, no hemolytic, and 2 based on the cell wall antigen, that is the Lancefield antigen, that is group specific carbohydrate as the groups A to H and the K to B, and 3 biochemical reactions as virulence, streptococci, and 4 growth conditions as facultative anaerobes and the strict anaerobes. Facultative anaerobes, for example, include the Streptococcus pyogenes and Streptococcus anaerobes. Strict anaerobes includes Peptostreptococci. Now the Streptococcus pyogenes virulence factors and pathogenicity. Virulence Streptococcus pyogenes cause both suppurative disease and non-suppurative disease, which is due to sequelae to the post-streptococcal infection. Streptococcus pyogenes cause pyogenic infections that has tendency to spread locally and along the lymphatics and through the bloodstream. And the Streptococcus pyogenes virulence factors include the cell wall associated factors and the toxin. Cell wall associated factors includes capsule and the carbohydrate antigen, protein antigen, and 4 pili or fibrae. And the toxins includes the hemolysins, fibrinogens include hemolysin and 2 fibrinolysin and DNase and NADase and hyaluronidase and 6 SOF and other enzymes. Now this is the image of the Streptococcus pyogenes cell wall showing the it is the structure showing the capsule, and this is the image showing the one, that is the virulence of the Streptococcus pyogenes showing the outer capsule and the cell wall composed of the outer layer protein and the lipothioic acid, middle layer made up of the group specific carbohydrate, and the inner layer made up of the peptidoglycan or mucoprotein. Now the in the cell wall cytoplasmic membrane and the cytoplasm. Now Well, you can also see fimbriae or the pillars. Now, the peptidoglycans are pyrogenic and show pyrogenic and thrombolytic activity. Now, C antigen. Now let's talk about the capsule. Capsule inhibit the phagocytosis. It is not antigenic in the humans. Now C antigen. C antigen is Lancefeld belongs to Lancefeld group A, and it shows C antigen shows cross reactivity some tissues of the human. See some human tissues. C antigen is extracted by the by Lancefeld acid extraction method and the Fuller's method and the Maxted's method and by Rans and the Randall method. The cross reactivity with the see, for example, is a capsular hyaluronic acid and the shows cross reactivity with the human synovial fluid. Likewise, cell wall proteins with the myocardium and group A carbohydrates with the cardiac valves and the peptidoglycans with the skin antigens and the cytoplasmic membrane antigens and the vascular intima. Now let's talk about the protein antigen. There are three types of proteins: M protein, T protein, and R protein. M protein it is both acid and the heat stable but susceptible to the tryptic digestion. It is about 80 M proteins are recognized. An M protein inhibits the phagocytosis similar to the capsule. Now T proteins is acid and heat acid labile but trypsin resistant antigen, and it is present in many serological types of the Streptococcus pyogenes, and it is usually demonstrated by slide agglutination test. As slide agglutination test. Now, R protein seen in some types of the Streptococcus pyogenes, say 2, 3, 28 and 48, and in some strains of the group B, C and G. R and T proteins have no role in the virulence. Now fourth, you can see this T and P proteins have no role in the virulence, but subtypes of Streptococcus pyogenes are classified based on the M protein because it is involved in the virulence, that is by inhibiting phagocytosis. Now fourth virulence factor, that is pili. It is seen in the group A, that is the group A streptococci. It consists partly of the M protein and covered with the lipoteicholic acid.